When most people hear blood pressure monitoring, they think of the inflatable cuff at a doctor's office. It squeezes the arm, releases slowly, and shows two numbers, systolic and diastolic. But is that the whole story? Not quite. Blood pressure is much more than two numbers. It reflects how blood flows, how stiff or flexible vessels are, and how hormones regulate the cardiovascular system. This raises a question. Could we measure blood pressure in a deeper way, not only from the outside, but also by peeking into the microscopic processes inside our bodies? This is where microfluidics and lab-on-a-chip technologies enter the scene. Microfluidics means working with tiny channels, often the size of human capillaries, where drops of blood or plasma can flow in controlled ways. Imagine a miniature laboratory the size of a credit card, that can test not just pressure, but also the chemical signals that drive hypertension, like sodium levels, stress hormones, or nitric oxide from blood vessel cells. Doesn't that sound more powerful than a simple cuff reading? For example, some researchers are designing sweat-based patches with microchannels that collect sweat and send it past sensors. These devices can measure ions like sodium and potassium, which are strongly linked to blood pressure regulation. Instead of going to a clinic, you could wear a patch that monitors your blood pressure trends continuously while you walk, sleep, or exercise. Another example, a drop of blood on a lab-on-a-chip could reveal whether your blood vessel cells are stiffening, an early warning of hypertension before numbers rise on the cuff. But could these devices do more than monitor? That's an exciting question. In principle, microfluidics could be used to release tiny doses of medicine when needed. Imagine a microimplant that senses when blood pressure is rising due to excess angiotensin II, a hormone that narrows blood vessels, and responds by releasing an inhibitor drug right away. Or think of a capsule designed to travel through the bloodstream, detecting chemical imbalances and delivering a balancing agent in real time. It sounds futuristic, but prototypes of such smart drug delivery systems are already being tested in other fields. Why is this important? Because hypertension is called the silent killer. It often shows no symptoms until it damages the heart, kidneys, or brain. By the time it is detected, the harm may already be serious. Microfluidics offers a way to catch the warning signs earlier and respond more precisely. Instead of one-size-fits-all treatments, lab-on-chip systems could help doctors choose the exact drug or dosage that works for each individual patient. Personalized medicine at its best. So the real breakthrough is not just measuring pressure differently, but connecting the microscopic causes to the macroscopic effect. The large-scale number we see on a cuff comes from countless tiny interactions. Cells sensing flow, molecules moving in and out of vessels, ions shifting between compartments. Microfluidics makes those invisible processes visible. Doesn't that suggest that the future of blood pressure management may lie not in bigger machines, but in smaller, smarter chips that live closer to biology itself? Microfluidic devices can mimic vascular channels at micron scales, allowing the study of how blood cells and plasma flow under pressure. By designing channels of different diameters, scientists recreate the resistance and compliance of real vessels, and pressure drops across micropanels provide direct analogs to blood pressure in arteries and capillaries. Sensors integrated on chip measure flow rates, pressure gradients, and shear stresses with high resolution, enabling both fundamental understanding and point-of-care measurement of vascular health. Microfluidics thus bridges cardiovascular physiology with engineering precision. A microfluidic chip reproducing capillary narrowing can show how high blood pressure leads to red blood cell deformation. It is like building a mini plumbing system where every pipe can be customized to behave like a real artery. Lab-on-a-chip devices can integrate piezoresistive or capacitive sensors that detect subtle pressure fluctuations. These chips measure not only static blood pressure, but also pulsatile waveforms linked to heartbeats. And microfluidic amplification of tiny signals allows precise readouts from small blood samples or even interstitial fluids. Because of their small size, these devices are portable and suitable for wearable integration, while data can be continuously logged and transmitted wirelessly, providing real-time health monitoring. This surpasses conventional cuff-based devices that only capture occasional readings. A wearable microfluidic patch can continuously track blood pressure through sweat or interstitial fluid. It is like switching from checking the time twice a day to having a smartwatch that tracks every second. Microfluidic platforms can simulate the effects of narrowing arteries, branching vessels, or variable wall elasticity. By flowing blood analog fluids under controlled conditions, researchers observe pressure-flow relationships in miniature, which helps identify how hypertension damages vascular networks over time. Integration with endothelial cell linings makes the chip biologically realistic, enabling tests of drug responses, and when coupled with personalized blood samples, such models provide patient-specific insights. Ultimately, they transform cardiovascular research into a controllable laboratory experiment. Endothelialized microchannels exposed to hypertensive flows reveal early signs of vessel stiffening. It is like building a scale model of a city's traffic system to see where congestion and accidents might occur. Beyond pressure itself, hypertension is linked to molecular markers such as nitric oxide, angiotensin II, or oxidative stress products, and microfluidic chips can detect these biomarkers with integrated chemical sensors. By combining pressure readouts with biochemical analysis, chips give a more complete diagnostic picture, improving early detection of vascular disorders. Multiplexed assays allow simultaneous testing for several hypertension molecules, creating precision diagnosis on a single compact platform. A chip measuring both blood pressure and plasma nitric oxide can indicate endothelial dysfunction before clinical symptoms. It is like checking not just the speed of a car, but also the fuel quality and engine oil simultaneously. Lab-on-a-chip systems enable controlled delivery of antihypertensive drugs into microvascular models. Researchers can test how medications relax vessels, alter flow, or reduce pressure at cellular scales, accelerating drug screening compared to traditional animal or human trials. Gradients of drug concentrations can be applied across parallel channels to map dose-response curves, and patient-direct cells can personalize the models, tailoring therapy for individuals. Such microfluidic drug testing represents a leap toward personalized cardiovascular medicine. A chip lined with patient-degraded endothelial cells predicts which blood pressure medication works best for that patient. It is like test driving multiple cars on a simulator before buying the one that suits your road conditions. Microfluidics not only measures, but can actively intervene in blood pressure regulation. Devices can release vasodilators or nitric oxide donors directly at chip-integrated vascular models, while bioelectronic interfaces can apply microcurrents to mimic neuromodulation of vessel tone. Such systems suggest future implants that monitor and correct blood pressure automatically with closed-loop feedback between sensors and actuators, stabilizing hypertension in real time. This blurs the line between diagnostics and therapy. A microfluidic implant prototype senses rising pressure and releases a calibrated dose of antihypertensive drug instantly. It is like a thermostat that not only reads the temperature, but also turns the heater on or off automatically. Flexible microfluidic chips can be embedded into skin patches, smartwatches, or textiles, monitoring blood pressure through sweat, tears, or microneedle sampling of interstitial fluid. Combined with wireless data transfer, this creates continuous monitoring networks where AI algorithms analyze trends to warn of dangerous spikes before symptoms arise. The fusion of microfluidics with wearables transforms hypertension management from reactive to proactive, bringing hospital-level diagnostics into daily life. A soft patch with microchannels measures ionic changes linked to blood pressure and streams data to a smartphone. It is like carrying a miniature clinic on your skin that whispers updates every second. Despite promise, microfluidic blood pressure devices face hurdles in robustness, calibration, and clinical validation. Biological fluids can foul sensors, reducing accuracy over time, And miniaturized devices must balance sensitivity with mechanical durability. Regulatory approval requires long-term human trials, which are still scarce, and manufacturing at scale while maintaining reproducibility is another challenge. Overcoming these obstacles is key to clinical adoption. Many prototypes show excellent lab results, but struggle when tested on diverse patient populations. It is like having a prototype car that works perfectly on test tracks, but breaks down in city traffic. The ultimate vision is microfluidic implants that continuously monitor blood pressure and administer corrective therapies autonomously. Integration with gene editing or regenerative strategies could one day repair vascular dysfunction at the source, while AI-enhanced chips may learn a patient's unique pressure patterns and adapt therapies accordingly. Global health could benefit as low-cost microfluidic patches democratize hypertension care in resource-limited settings. By combining monitoring, diagnosis, and intervention, lab-on-a-chip may shift hypertension from a chronic burden to a controllable condition, representing the merging of physics, chemistry, and medicine into a unified therapeutic platform. A fully integrated microchip implant that senses, analyzes, and stabilizes blood pressure in real time is under conceptual development. It is like upgrading from a weather forecast to a climate control system that prevents storms from forming at all.